Hi everyone, my name is Angelica Nocerino and I'm a second year GI fellow at Lenox Hill Hospital in New York City. Today is April 26th and it's been well over a month since New York City has been on lockdown because of COVID-19. Today I just wanted to take some time to tell you about my experience so far. How has COVID-19 affected my life professionally? My day-to-day has drastically changed. Instead of scoping, seeing my GI patients, working closely with my GI family and faculty, I'm now helping out as a hospitalist for COVID-19 patients. To be honest, before my first shift as a hospitalist, I was very anxious and scared. I worried about donning and doffing off the PPE correctly. I worried if there would be enough supplies. I worried that I might get the virus myself. And really, I worried about the patients. There's so much uncertainty with COVID-19, and we're continuously learning new things about the virus day to day. And I worried about how the patients would do. Luckily and fortunately, I did see a lot of patients do well and go home. So that definitely brought a lot of hope. But I also saw certain patient populations who didn't do well and they would deteriorate before your eyes. And it was very frustrating because there was not much you could do. But even though it was a very challenging time, it was definitely rewarding professionally. And I feel like it really has helped me to grow as a doctor. Not to mention, even though the hospital, it was stressful and people around you were anxious and nervous, it was so amazing to see everyone come together. For example, on my team as a hospitalist, I had surgical residents, OBPAs, people from all different specialties that otherwise I wouldn't normally interact with. And it was just a wonderful experience to see everyone come together, support each other, help each other out, act as a team, and fight for a united cause. Not to mention, there was so much outpouring of love from people in the community, people from all over the country, sending snacks, sending goodies. And it really was a reminder that we're not alone and that we're fighting this together. So although it was a stressful experience, it definitely has been very rewarding. And it really, really has helped me to grow as a person and a doctor. How has this COVID virus changed my life personally? Honestly, it's just been lonely. My husband, he lives in Washington, D.C. He's finishing his fellowship. And normally, I'm able to just jump on Amtrak train and go visit him. And honestly, that can't happen right now. So I miss him. And I worry about his health as well because he's taking care of patients with COVID-19. And even though I have a lot of family and friends in New York City, I'm not able to see them because I'm in the hospital and I'm worried that I'm exposed. I'm afraid that I could bring the virus to them. So I haven't seen a lot of friends and family. Thankfully, there's FaceTime, there's Zoom, so I'm definitely keeping in touch with my friends and family that way. Really, I just miss the buzz of New York City. I miss walking the streets. I miss going into stores. I miss going into all the different restaurants for girls' night out with my friends. And it's very quiet now. It's very different. But every night at 7 p.m., I'm reminded of the spirit of New York City. And you can hear the cheering. It gets louder and louder every night. And it's really touching. And it reminds me that New Yorkers were resilient. And I'm very proud to be a New Yorker. And I know we're going to get through this together. We're going to just keep fighting the good fight. And we're there for each other. And one day we'll be able to be together again. So that's really what my experience has been so far. And I hope everyone stays safe and well. And I know that we'll be together again soon. Take care.